كونفو، لوين اليوم؟
هلا أبو الزوز، مرحب بكم جميعا، مساء الخير عليكم. اليوم نحن جايين للعيادة النفسية نقابل الدكتور مارشال أوبراين، وإن شاء الله يا رب نستفيد. Mr. Marshall O'Brien, we really appreciate your time.
Thank you.
And we appreciate that you let us come talk to you and tell our audience a little bit about Marshall O'Brien and how many years you have been psychologist, please.
Oh, okay. Well, many years ago, I studied psychology in England, in the north of England, at Durham University, because I had spent 3 years studying towards the Ministry of Religion before that in Australia, and discovered a great interest in psychology because I was interested in how to help people. And since then, 1970, I've been in one way or another working in psychology and further studies and research.
Mr. Marshall, it's honor seeing you here.
Thank you.
And I will start with the question. Why mental health affect people's lives?
Well, it's become very much more notable in the last 30-40 years that people notice that they're not feeling very well, and it's not so much because that they're actually sick physically, but it's the way that they're living their life or problems that they have in their life. So people have become very much more sensitized to talking about that, and we call it mental health.
Yes.
So now we have some pretty clear ideas about what that can be, because most people at some stage are going to not feel that they're happy with what's going on in their life, maybe their work or the relationships, and that's normal. But when the feeling of not being happy gets stuck, you might then decide that's something I need help with. That we give it an official name called depression. But depression is a whole range of things. It could be just you're irritable all the time, angry all the time, or you just can't get out of bed, feel tired all the time. Or sometimes you just don't feel like eating, don't feel you can get out of bed. Think everything is gloomy, not happy. That's really that. But there's many forms of unhappiness. People can become very anxious, which is an agitation, and they feel they've got to hide themselves and stay at home, don't go outside. And of course then there's other types of problems that are more rare. People become manic. They run around too much, they get frightened by too many things. Sometimes there's just other more severe cases where people start to think very strange thoughts, where they might be frightened by the thoughts they're having. Then it becomes a much more serious issue, which we might call schizophrenia or other types of illness. So there's a huge range of things that can happen, but the vast majority of people will at some stage be anxious and some stage be depressed.
Then I will take it from here and phrase my question. As we know, depression is a common medical sickness, and some people they get ashamed of it. Some people they want to hide it, like you mentioned. What's the best way it's to solve this and to get off the depression in general? What you have to do, like sports or community activities? Where is the best medication?
The best medication for all the forms of mental issues would be to talk about them. Okay? And with depression in particular, there is enormous value in sharing how you're feeling with somebody. But it could be a friend, or it could be a partner, you know, a wife or a husband. And that way at least you start to energize yourself, to start to think about You know, some people need to say what's going wrong in their life for themselves to even begin to think about how they might fix it. If it's a severity like schizophrenia, for instance, where the person is not thinking very well and is saying things that just don't make sense to the people that know them, you would think probably there's going to be a need for drugs, psychological drugs. And that's the province of the doctor himself or herself, or by referral to a psychiatrist. If it's a problem of feeling and a lack of motivation to do things and to actually maybe give an impression that the person's going to harm themselves, that could go to a psychiatrist, but often comes to a psychologist. Because sometimes people are depressed because life is not working for them.
Yes.
Their job, or the studies they're doing, or the relationships they have are not working well.
Some people, when they got depressed and they go through hard time, and then they go taking medication. Some of them, they taking those medication for almost forever.
Yes.
And some of them, with help of maybe community, relative,
Yes.
one of my family members, they can offer quicker and easier. Plus also sports and
Very much so.
activities.
Yes.
So
Yes.
what the best advice for someone is taking for many years tablets or medication for depression?
Well, in the time that I've been practicing,
Yes.
we've changed a great deal in our understanding. It used to be thought that medication was the only way to treat these things.
Yes.
And that comes from a belief that all of this is to do with the way the brain chemistry is working.
Yes.
And the theory was it's not working well. Now, the brain chemistry is going to work well if you are engaged in your life, if you are busy and socially active, and you're fit.
Yes.
So if those things are not right for you, you need to do more of those, like being active in sports or physically active in your life, or having good social relationships. That should do it for the basic needs of being connected in life.
Yep.
But when it's beyond that, you need extra help.
Okay.
And from the earlier days, it was thought that you had to stay on those tablets for a very long time. Now, you would say maybe 3 months and then you review, and maybe 6 months you should review again and maybe cease that, because the chemistry is going to always fix itself. If you then change your behavior in your life, like not stay at home, not hide in bed, or not drink a lot of alcohol or street drugs to make yourself feel temporarily good,
Yes.
or stay in very unhappy relationships or jobs where you're bullied or made to do bad things, you know, hurt yourself.
Yes.
Yeah.
So, and what I would try to say to our audience, mental illness or depression, it's like any other sickness. We shouldn't hide it. We shouldn't be scared of it. We shouldn't be ashamed of it.
Yes.
And that's the message we was trying to cross it to other people. And if you have one of your members sick or yourself, please go see psychologist and seek for a solution.
Yes, yes.
Yeah.
A very small portion of all of the things that could be thought of as mental illness would require medication.
Yes.
Okay? For depression, which is very common, yes, the medication will assist you, but you still have to make changes to your life. And you might need to have people help you with that. Sometimes that can be a friend. But if the friend doesn't know you're depressed, and a lot of men like to hide it,
Yes.
they pretend
They're
that
so-
they're okay, and then they resort or turn to drugs or something else. Now I say to men, that's fine. You are in charge of working this problem out for yourself. But maybe by talking about what has led to this, we can help point out where things are not working well for you. It's like getting advice. Okay. Now women tend, on the other hand, to talk about these problems with each other more than men, but that doesn't mean to say that the person who's listening can actually help you in to find a solution. Because sometimes you already have the solution if you thought about it. I might be able to let go of that issue or leave my work and try somewhere else, but I'm scared to do it. But with some encouragement, support, maybe I can take those steps. Very often, our thinking is limited.
Is it related to self-confidence?
Well, obviously everything, all of these issues come back to myself, yourself. So the science of psychotherapy is to help the person really start to grow themselves and to become more self-confident. Otherwise, what is the point? There's no value in you just becoming an automaton doing things the way other people will do it. That would be almost a guarantee to end up depressed. If you want to be yourself, you want to be able to relax into yourself, you've got to feel you're doing it the right way for you. So you're comfortable and confident. Yeah. Which we call self-esteem.
Self-esteem.
Yeah.
Thank you.
You know someone got through depression and then commit suicide because he didn't get help. That's really make me upset. And the percentage of people committing suicide when I was reading about before we come to see you, it was more male, and that's when you said men, they hide it and they don't talk about it. They go drink alcohol or take drugs.
Yes.
Compared to females, they talk to each other. So in most of cases that people commit suicide because they don't get help from their family or the community.
Yes.
That's why I keep repeating, I said mental illness or depression, when you think like you go into the dark room and you hiding, you don't want to go see help, that's wrong.
Yes.
So that's why I wish we may save someone's life by talking about this.
Please, let's hope so. Well, I would like to say to you in summary, people get to feel so unhappy and so isolated from their friends and family. The pain they feel inside leads them to think, well, what can I do? And I want the pain to go away, and they might try drugs, street drugs, alcohol, anything that gives them a bit of short-term relief. And then they get into despair. And that's when they sometimes, especially young men, because they have access to things that are violent, like guns and cars that they might drive into a tree or something very fast, and cut themselves, they will take something or do something that is fairly lethal. Whereas women may actually overdose on some medication, but if the family finds them or somebody looks after them, they'll take them to the hospital and they can be revived. It's a dreadful loss to community. We lost 5 men last week to suicide in this community. So we are missing and losing out as a community from the value of those people in their families and what they might do in their lives. All that they need to be willing to do is to share their grief, their unhappiness, or maybe they're upset because somebody has rejected them, or they failed an exam or didn't get a job. There's a solution to that. They can get another job. They can do exams again. They can meet other people who will like them. But they've got to live a bit longer to discover that. Can I just make one final plea?
Sure.
when somebody tells you that they're upset
Yes.
or they feel bad, or they might say, I feel depressed, don't try and be the doctor.
Yes.
Don't try and solve their problem. Just be with them.
Yes.
Talk to them. Go for a walk. Have a coffee. Have a beer. Whatever you're allowed to have in your culture or social life.
Yeah.
Go and have a meal together and just be with them.
Yes.
Okay? That is very important.
So don't leave them alone.
Don't leave them alone.
Yes.
No. And don't let them hide for
Yes.
too long.
Yes.
Some time. In bed, sleeping, but then be with them.
So that really the main issue at this time when they are alone, they may have harm themselves.
That is a real risk, especially if they feel just nothing is available. Nobody cares.
Sure.
So if somebody rings them, somebody knocks on the door,
Yes.
or says, hello, how are you? And calls them by name, that helps.
Excellent. Mr. O'Brien, thank you very much for your
You're welcome.
time.
Thank
we
you very much.
really appreciate this. And if we need to have to come back again, can we come back?
Of course you can, as much as you like. This is
Yeah,
good,
we
what you're
agree.
doing.
Yeah, thank you very much. We appreciate it. And now we will invite to coffee.
Yes, please.
So we can talk about more. Thank
Yes.
you very much, sir. Thank you.
بعد زيارتنا لعيادة الدكتور مارشال بتمنى تكونوا شوي استفدتوا معنا وتعلمنا كنا انه ما نتردد نروح عند حكيم نفساني، مش عيب مثل اي شيء يعني اي حدا يحصل له اي مرض حيروح عند الدكتور، فهو اكيد تاكدوا انه عنده حالات اسوء من عندكم بكثير. شو يا كونفو؟
نحن استفدنا كثير، نحن استفدنا من لقائنا من الدكتور، وخلاصة الحلقة دي اللي عايزين نقوله، لا حد يشوف انه مثلا لو عندك اي حد في الأسرة بتحس انه قاعد يعاني من اي مرض نفسي، ما تخبي الانسان ده، ما تاخذ انه المجتمع حينظروا فيك شنو او عيب او كده. زي ما قال الدكتور انه نحن اي شخص يعاني من حالة نفسية ما نترك له، ما نخليه براه، ما
يا جماعة باللبناني يعني لحاله.
يا عمي ترجم يا عمي فالقصد انه احنا ما نخلي الشخص المريض، الشخص اللي بيعاني من مرض نفسي لوحده او براه. وثاني حاجة نشغل نفسنا برياضة زي ما قال الدكتور، انه خليك اكتف في المجتمع.
نشيط، ايوه. ولاحظت شيء كمان كونفو اللي قاله ما تخفف من مشكلته، يعني انت بتتعب نفسيتك بسرعه بتتعب، لا ورشيه انه مشكلته كبيره وتعال احكي معي خليني اسمع شو عم تقول.
اللي هي بدايه العلاج انك تصدق الراجل ده الشيء قاعد يعاني منه، انك تصدقه، وغير كده ما تعمل فيها انت الدكتور.
صح.
انت ما تعمل انت الدكتور، شيله، تطلعه، ساعده، اسمعه
شيء تسمعه
بالضبط،
وما تقلل له حجم مشكلته
بالضبط.
تخفيها.
فنحن عندنا مثلا زي المرض النفسي او العنف ضد المراه والطفل او اشياء دي لازم نحن نتناقش فيها وبحريه، هي دي. والناس لما تتكلم وتوصل لنقاط تعالج فيها، هنا الناس بتستفيد وهنا الناس بتعالج النقاط. فعشان كده حاولنا بس نسلط ولو ضوء خفيف بسيط على حتة المرض النفسي، ومش هو عيب، وزي ما قال أخوي زاهر مرض زي أي مرض عادي. وإن شاء الله نتمنى أن تكون استفدتوا ونحن استفدنا عن نفسنا، وإن شاء الله حنتناقش في أمور تانية، ويا رب إن شاء الله تكون
عجبتكم الحلقة. وبنهاية الحلقة بليز لايك وسبسكرايب وشجعونا نكمل سوا.
وشكرا.
باي باي.